It's early Wednesday afternoon and the Portland Police Bike Squad is on the move, patrolling downtown in one of America's most progressive cities.
That's meth. And that's fentanyl. This is non-criminal amounts, right? So I think more, let's just use this as an education opportunity. Show these guys, and then in a minute, if you could pack this stuff up and leave. I will have to take these though, okay? You can see the meth is crystalline, and this is like chunk powder on the fentanyl. All right, let me stick this in here.
Open use of hard drugs like crystal meth or synthetic opioid fentanyl isn't currently a criminal offence here. Back in 2020, voters backed a revolutionary change in how it approached drugs.
Oh, don't go hiding it now.
So-called Measure 110 meant that police couldn't arrest people for drug use, but would nudge them into treatment. Care instead of punishment was the aim.
We're gonna give you a ticket here. You gotta call this phone number. See this thing right here? You call this phone number, and then they're gonna ask you if you want drug treatment. And then all you have to do is say yes or no, and then they'll make the ticket go away.
They're fine, I already checked on them. There's a guy around the corner, same thing.
But police say almost no users actually call the number, and the inability to arrest people meant drug use grew alarmingly fast in the past 3 years.
Hey, like you got the kids' playground right here. You're not supposed to drink in the park, all right?
I live here. You know, it affects where I take my children and, you know, where I can go in the city. And, you know, there's a lot of great stuff here in Portland, but, you know, there is that kind of grimy layer, unfortunately. You know, public drug use is tough to explain to your small child.
Not only
Amy Nichols says it's also been tough on small businesses like hers. She's had to deal with an explosion of vandalism and crime in recent years, which she blames on lax drug laws.
We'll have to deal with a lot of drug addicts coming in here, like drooling or whatever, and screaming at the customers for water. We've had beer cans thrown at us, glassware thrown at us, garbage sacks. They'll come in with sleeping bags, and it just creates an environment. You have the needle deposits in your bathroom. Are your bathrooms locked like ours are?
Yeah, they're.
Amy's currently running for local government. She's pleased the state is now switching course. Measure 110 is effectively being withdrawn, and hard drug use will once again be criminalised in the state.
The decriminalization of it, it created an atmosphere where it was just lawless. Like you could do whatever you wanted, and there's no accountability in Portland.
The rise in popularity and harm caused by fentanyl in the United States is just extraordinary. 4 years ago, about 13% of overdose deaths were because of fentanyl. By last year, that had risen to more than 70%. Meanwhile, here in Oregon, it's particularly acute, with a more than 40% rise in the overdose deaths due to fentanyl in just 1 year.
You ever heard of the BHRC?
Yes.
You think any of those kind of services would help you today?
Former addict John Carp Evans now works in outreach, trying to connect users to services. He says fentanyl's low price makes it attractive.
You can get fentanyl for less than $1. And in Oregon, we have a bottle deposit on pop cans, soda pop, beer cans. You can find empty cans and return them for 10 cents a can. So we could walk around the neighborhood, probably find 10 cans in less than an hour, walk to a store, get the $1, and then go buy fentanyl. And that could be enough fentanyl to kill us.
Drug possession will once again be a crime, but an initial conviction will result in probation, not incarceration. Subsequent violations could lead to jail, but the actual implementation of the new rules are still being worked through.
It does recriminalize, you know, small amounts of drugs, which does allow us to search people. You know, are we going to take people to jail? I don't know. Are these criminal cases, are they going to have public defenders for them? I don't know. So there's a lot of unknowns right now because it's early on. I think later this summer we're going to have a better indication of what that's going to look like.
Measure 110 also has supporters. It provided funding for this recovery centre, which helped get former addict Breezy clean, 17 years after first getting hooked.
So is this the first time you've been back
Yes, it is the first time I've been back since detox. It feels really good to be back. When I was, I think, 14, I tore the labral tendon in my shoulder and I had surgery on it. And so I got prescribed painkillers and I got addicted to those. And then I started buying them off the streets and just, you know, that soon led to heroin and then injecting heroin. And then I started doing meth and then the fentanyl came about.
Breezy has gone through multiple attempts to get clean.
Putting people in jail doesn't really solve the problem. You know, I know for me, when I was on probation, I just kept like getting violated and I'd go back to jail. Like I would be out like a day and I'd go right back that, you know, like that same like next day or whatever.
She's been drug-free since late last year.
I feel like introducing recovery as like a step is very important for people because a lot of people do want a chance. Like people living on the streets, they don't want to live like that. They want to be able to have a chance to like, you know, come to somewhere like here and actually detox safely and not on the streets.
We do write people tickets, we give them the drug screening cards, but we're not able to displace these groups of people. They have to voluntarily leave. And we've cited people, you know, days in a row. We get to know a lot of these folks, but at the end of the day, we're just able to only write tickets, and I think that's what frustrates people.
It's going to be a lot easier. Like if you have.
John says he'll continue providing what support he can and hopes to continue working constructively with the police, and hopes more resources will be put into treatment, even as drugs are recriminalised.
You know, I was able to get clean and sober through the criminal justice system. Lots of my friends were able to get sober through the criminal justice system because it was an option. Not because it was the thing we needed necessarily, but it was the only option in our community to seek treatment and has been for so long. And so that's the biggest challenge is that, you know, the criminal justice system doesn't fix anything. You need clinical services on top of that.
If you're going to build a decriminalization model, you actually have to build treatment centers and you actually have to build rehab and off-ramps for people from addiction before you just rampantly decriminalize all drugs. And being the guinea pig state, you know, there's 50 states in America, and Oregon, we're the only one that's decriminalized drugs, and it frankly sucks being the guinea pig.